Obsessive compulsive disorder is similar to other mental illnesses. It can go hidden for years before people seek help and get a proper diagnosis. Obsessions are recurrent intrusive, unwanted thoughts. Typically they produce anxiety or distress, which leads to repetitive behavioral acts called compulsions. Mike is sitting in his home office when a random image of an intruder flashes into his mind. He tries to avoid it, and he continues to work. It is not a problem to this point. Sometimes this image will flash again. He checks the backyard and locks the house door. Then he goes back to his office work to resume his tasks. What if this image invades his mind again and again with more intense forms? He starts developing anxiety that gets out of control and leads to compulsive behaviors such as running to check the backyard multiple times, the basement a few more times, retightening the locks on the doors, and a growing list of reactions to ease the anxiety. All of that is happening while Mike knows no one else is there, and now he cannot finish his work tasks on time. The estimated lifetime prevalence at 2.3% of the United States population. Females are more likely to suffer from OCD than males. In general, OCD cases may start in childhood. 75% of cases onset are earlier than the age of 30. The recurrence and severity of obsessions and compulsions vary among people. Obsessions can be a thought such as stabbing someone, an image of a disaster, or an urge like jumping in front of a moving truck. Compulsions may manifest as behavioral or mental acts, and they can become rituals. They range from washing hands too often despite the formation of dermatitis, can lead to suicidal events, and severe depressions if no professional intervention is offered. The causes of obsessive compulsive disorder are not fully known. Increased risk is associated with genetics by running the disorder from a parent to the child. Environmental factors play a role, includes bullying. Compulsions are learned behaviors that can become rituals after experiencing stressful life events. And not last, abnormally low levels of serotonin in the brain may cause OCD. 4 criteria as per DSM-V are required to qualify for a diagnosis of OCD. Here is a simplified version of the points. 1. Presence of obsessions, compulsions, or both. 2. Those obsessions and behaviors are time-consuming in that they impair normal daily life activities. 3. Above signs are not the result of consuming a drug or medicine. 4th, another disorder does not better explain the signs and symptoms. Example of bipolar disease, ADHD are among others. OCD is a resisting disorder, but improvement happens in 75 to 85% of patients after proper therapy. The treatment is a combination of cognitive behavioral therapy and medications. CBT is the treatment of choice. It helps the patient recognize and change their thought patterns and behaviors. Some medications, especially antidepressants that influence the serotonin system, have been found to decrease the symptoms of OCD. These medications are only available under a prescription, given their potential side effects. It usually takes several weeks for this group of medications to deliver adequate effects. If you have enjoyed our content, please like and subscribe. To support our channel, share the content with your family and friends and let us know in the comments below about your experience or